Welcome to this tutorial session. So in today's session, we'll be answering one important question in adult surgical nursing. So this particular question can apply to those that are doing the BSc program in nursing, even to those that are doing diploma programs. Okay, so I'm going to read through the question, and then we're going to go through it so that we see how best we can answer this particular question that we have at hand. Remember to subscribe to this YouTube channel because it provides you with the much needed content that you need in line with the various programs that you are studying, especially for those that are doing, a Bachelor of Science in Nursing, midwifery, diploma programs and the likes. Okay, so this question is under, the essay questions part. So the question reads as follows. Mr. Chinterelwe, Chakuba letter A, 50-year-old married and a farmer is brought to casualty in a shock state. A diagnosis of acute abdomen is made and is scheduled for exploratory laparotomy. I'll read the question again. So, Mr. Chinterelwe Chakubaleta, a 50-year-old married and a farmer, is brought to casualty in a shock state, and with a diagnosis of acute abdomen is made and is scheduled for exploratory laparotomy. Now, what you need to know as a student is that whenever they give you a question in a scenario kind of form, pay particular attention to the scenario, especially if you are talking about courses such as adult surgical nursing, because that scenario, as you can see here, they are mentioning something like this. Mr. Chinterere is a farmer, okay, and then he has also been brought in a shock state. When answering these questions, sometimes you do refer to these important statements that are being made in the question. So let's take note of that to say this particular patient who has been brought, of course, 50-year-old, is a farmer and is also in a shock state. Above all, this particular patient has been scheduled for what we refer to as the exploratory laparotomy. So for those of you that may not be familiar with this particular procedure, so if you're talking about laparotomy in general, so this is a medical procedure that involves the incision or making an incision on the abdomen. Of course, having access to various abdominal cavities that the surgeons are interested in. In this particular context, you can see that it has been written to say exploratory. So it simply means that the surgeons that are going to perform this procedure are not sure of the actual specific region where they're supposed to, handle or go to. So they're going to explore in order to be able to find the actual, causative problem to this acute abdomen that this patient is having. Remember that the diagnosis of this particular patient is what? Acute abdomen. So let's begin by answering the first question. So the first question is demanding us to be able to define what we refer to as the acute abdomen. Now, it's very, very important to be able to define the first question properly, especially if you're dealing with essay questions, because most of the follow-up questions, they're usually in line with the first question. Now, acute abdomen is one of the important topics that you're going to come across in adult surgical nursing, including those that may be doing, surgical medicine, that course which is combined, med-surg. So acute abdomen is a very, very important topic because it covers a lot of subtopics that you're going to find under it. So let's first begin by answering the first question. So the first question is saying define acute abdomen. Now you are well aware that according to NMCZ standards, if you are defining something, at least make mention of at least maybe the cause, even one or two causes, okay, even maybe a sign, okay, even maybe some characteristics or duration. So if you're defining acute abdomen, it's supposed to read as acute abdomen. This is severe, sudden abdominal pain that is characterized by what? It could be vomiting, it could be nausea, it could be headache or abdominal pain that usually lasts, okay, less than or equal to 24 hours and needs immediate surgical attention. So you've seen that in my definition, I've brought a lot of content in it. I said acute abdomen, this is severe sudden abdominal pain that is characterized by vomiting, nausea, okay, or even abdominal pain that usually lasts less than 24 hours and needs immediate surgical what intervention. So that's how you get to define this particular acute abdomen. You can see that the marks that have been allocated to this question is 5%. So it wouldn't just require you just mentioning maybe just one term or one particular aspect in the definition. Okay, so that's how you get to define acute abdomen. We've talked about the fact that this kind of condition is severe. It's also sudden. Apart from that, we've been able to bring out the characteristics to say it's characterized by what, or maybe the signs and symptoms. Okay, you've got what we call vomiting, nausea. It could be the actual abdominal pain. Okay, the act of severe abdominal pain, and we have talked about the duration in the definition to say it usually lasts in less than 24 hours, and apart from that, it requires immediate medical intervention. In some books, they even say that if you don't attend to a patient who has got acute abdomen, the chances of them losing their lives are very high. They will stop being alive. Right? That's what we're saying. Okay, then the second question on A is saying that list 7 causes of acute abdomen. 7 causes of acute abdomen. This particular question requires a student who really understands surgical nursing very, very well. Remember I said, if you're talking about acute abdomen, it's a very complex topic that has to do with various subtopics in it. There are a lot of causes that bring about acute abdomen. So just to mention but a few, we're going to start with what we call intestinal obstruction. Intestinal obstruction. So one of the causes of acute abdomen is what we refer to as the intestinal obstruction. So there is the word intestinal from the intestines, then there's the word obstruction. Simply means that the intestines have been blocked. Okay? The passage or the pathway of the intestines have been what? Have been blocked. Now, this intestinal obstruction at BSc level, it could be caused by various things. There's what we call mechanical intestinal obstruction, which can be caused by things that are tangible, physical. Okay, it could be as a result of constipation, for example. Okay, this can cause what we call intestinal obstruction. So you should understand as a medical student to say, if at all the intestines are blocked, meaning there will not be bowel movement really. Okay, meaning the content in the intestines, for example the fecal matter, will not be able to pass as it's supposed to do. So what is going to happen is that, of course, this particular content, of course, it is kind of acidic. It will start damaging the intestines, and of course it can cause damage to various organs that are close to this particular area, as well. I mean, bringing about what we call now the actual acute abdomen. Apart from that, the second cause is what we refer to as what? Appendicitis. So I think, or I should believe that most of you are familiar with what we refer to as the appendix. So the appendix is one of the organs, okay, that you're going to find within the large intestines. Okay, if you follow through, there's what you call the descending colon, ascending colon, and the cecum area. Just below that area, there's what we call the appendix. Okay, it's like a finger-like structure projection that you find on the intestines. So this particular appendix, it doesn't really have that much physiological significance in the body, but if at all it's undergoing what you call inflammation, because when we say appendicitis, this is the inflammation of what? The appendix. It can bring about what we call acute abdomen, because as a medical student, you understand that inflammation comes with pain. Inflammation comes with various signs and symptoms that may induce this acute abdomen that were defined on part A. The other cause of intestinal obstruction is what we refer to as the peptic ulcers. So peptic ulcers, of course, these are just ulcers that take place, of course, in the GIT. Okay, in the GIT, that is starting from the stomach going up to the esophagus. So the peptic ulcers, these are just basically sores. Okay, sores that are within this GIT region that I've described. Okay, so these peptic ulcers, of course, they will bring about what we call inflammation. I've always advised students that when you reach an academic year where you're talking about conditions, medical conditions, it's very, very important for you to fully understand the inflammation process, the inflammatory process, because most of the conditions that we'll be talking about will be related to what we refer to as the inflammation. So when I talk about peptic ulcers, if at all you've not maybe come across this particular topic, what you have to know is that peptic ulcers, these are just sores that are within the GIT region, starting from the esophagus region up to the stomach and up to the gastric or stomach region, somewhere there. So the sores that would occur within this region. Of course, these sores will bring about pain. So this pain now, remember, we are talking about acute abdomen. This is the pain that this patient is experiencing. This is the pain that this Mr. Chinterere is what experiencing. Apart from that, what could also cause, in this acute abdomen is also what referred to as, sometimes there's what referred to as peritonitis. Peritonitis. So peritonitis, this is the inflammation of what you call the peritoneum. So the peritoneum is a region that is, it's basically a layer, okay, within the abdomen that covers or protect the abdominal cavities. Should there be inflammation in that particular region, this will bring about what? Pain. Remember I said inflammation comes with what? Pain. So we've talked about intestinal obstruction being one of the causes, appendicitis, peptic ulcers, peritonitis, okay? Then the other cause that is not also common is what referred to as gangrene. So this gangrene, could come as a predisposing factor to the actual acute abdomen, because at the end of the day, this gangrene, of course, depending on the type, it will bring about what? Inflammation. Sometimes what could cause this acute abdomen, it's possible if at all a patient has undergone surgery, okay? There's what we call secondary hemorrhage, or maybe you find that the wounds or the incision that had been made in this particular, abdomen, maybe they are opening up and something. And then they bring about pain, they bring about inflammation. So that could also bring about this particular acute abdomen. Okay? That could also bring about this particular acute abdomen. Then the other question that we must handle here, due to time, I'll focus on the major question, which is showing 55% there. That is you being able to describe what referred to as pre-operative nursing care. Pre-operative nursing care. So just to guide you, it's very, very important for you as a student who is having this course, surgical nursing, to know what we call peri-operative care. So when we say peri-operative, we don't mean pre, we don't mean intra, we don't mean post, but we mean the care that we give to a patient that is undergoing or who is about to undergo, or a patient who is coming from surgery. So it's a collective term. We say perioperative care. It's a collective term that is describing the care that we give to a patient who is about to undergo surgery, who is going to be in the surgical procedure, and the patient who is going to be taken care of after the surgery. So there are three things involved. So one of the components of this perioperative care is what we refer to as pre-op. So most of you maybe have gone on the wards and then you've seen patients when they're giving handover, they are more like, this patient on bed number 15 is a pre-op, or this patient on bed number 17 is a post-op. Okay? Maybe the term that you may not be familiar with, what we call intraoperative care. That is the care that we give to the patient, who is the care that we give to a patient during the actual surgical procedure. But in this particular context, we've been asked a question to answer or to write, okay, or explain the pre-operative nursing care that we're going to give to Mr. Chinterere. Now, remember I said you have to always pay attention to the question, the way it was described in the question, to be able to write certain things. So Mr. Chinterere, when we're writing this pre-operative care, what we have to do is that we have to write it in a systematic way. There is a way that we write this pre-operative care. We just don't start writing, no, I'm going to do this, I'm going to do this. So always remember that they are always interested in seeing how you are able to write this pre-operative care. Not just in your respective schools or universities, but even at NMC-Z level, there is a certain way this pre-operative care must come out. And it should always start with what we call the M. Now, if you ask yourself, what is the M? Why are you giving this pre-operative care? When you say pre, it's before the operation. So it's the care that you are giving to this particular patient before the operation. So you write the M. So what is the aim of this particular care that you are giving the patient? One, you could say that the aim of this particular preoperative care is to prepare the patient physically. So if you're talking about preparing a patient physically, it caters for things such as making sure that the patient is wearing appropriate clothes, making sure that the patient maybe has been bathed and everything. Okay, the patient has been shaved and everything. They don't have any jewelries on them and stuffs. So that is one of the purpose or aims of this particular preoperative care. Then the other one you can say to also prepare a patient is psychologically. So when you're giving preoperative care, there's an element of psychological care that you have to give to this particular patient. So as they are going inside that operation room, they are psychologically, prepared. Apart from that, the most important thing that you are trying to achieve here, or your aim on this preoperative care, is that you want to minimize or to eliminate any form of complications. So you are making sure that this care that you are giving to this particular patient, you want to prevent complications after or during the surgery. So those are the aims of this particular preoperative care that you are giving to Mr. Chinterere. After you write the aims, you now move on to the actual preoperative care that you'll be giving to this particular patient. I should make mention that if you're writing preoperative care, there are different ways in which you write, because there's what we call elective preoperative care, there's what we call immediate or emergent preoperative care. But I'm going to give you the general guidance, the general preoperative care that you have to give to a patient, especially in this particular context that they have asked us, because we're supposed to answer this question in line with what we've been asked. So, number one, you have to talk about admitting. So you have to admit the patient. So you say, you write number one, admission. Then you say, I will admit Mr. Chinterere to what? To the surgical ward. So the first thing that you have to do is that you need to admit this particular patient. How would you take care of them if they're not admitted? So you have to make mention to say, after write one as admission, then you say, I will admit Mr. Chinterere to surgical ward. Simply means that they will understand that you'll be able to perform the actual admission procedure. And then after that, now you move on, you talk about the environment. After admitting Mr. Chinterere, where do you take him? You talk about now the environment. So on the environment, as point number two, you write on the environment one, I'm going to prepare the bed. Okay, I'll make sure that I prepare the bed as preferred or as prescribed by the doctors. Okay, depending on how this patient is feeling. Apart from that, on the environment, talk about ventilation, talk about lighting, talk about cleanness. So you mention all those things like dam dusting, making sure the windows are open. You're talking about the environment in that particular context. Okay, then apart from that, point number three, you can talk about what? Hygiene. So after you've admitted Mr. Chinterere, you've been able to prepare the environment properly. You talk about now hygiene. So in terms of hygiene, you talk about making sure that he has been able to bath, making sure that he has been able to brush his teeth and everything. That is falling under what we call hygiene. After you do that, you also have to give him psychological care. So this is the care that I was talking about on the aims. So it should come out in your what? In your preoperative care. So on psychological care now, you write what you'll be telling Mr. Chinterere, the actual things. So you're going to be using statements or phrases like, I will encourage Mr. Chinterere to be strong. I'm going to, advise him to say this particular surgery has no, complications. If at all things are handled properly, or if at all there are complications, you mention them, so that he is aware, so that he is mentally ready for that particular procedure. Okay? Apart from that, besides talking about the hygiene, you also have to talk about nutrition. So this particular patient, okay, is a patient. Okay? So you will not keep him hungry, of course. You will not keep him hungry. So on nutrition, you have to now, this is where you have to be careful, because this patient is about to undergo this surgery, is about to undergo the laparotomy surgery. So give him the food that will be prescribed by the doctors. If they have said Niope oral, he is not supposed to drink or eat anything orally, you're going to stick to that. Okay? In some aspects, we even emphasize on the point that you have to starve the patient probably 5 to 6 hours before or prior to surgery, because when they go to surgery, they are going to be in pain. They'll be given anesthesia, their muscles will be loose. You don't want them to be passing bowels while they're in surgery. So you have to starve this particular patient. So all these elements, you tend to mention them on what? On nutrition. Apart from that, you also have to talk about vital signs. All these points that I'm listing, you talk about vital signs. So vital signs, you say, I will check the blood pressure, I will check the temperature, I will check the respirations, to be able to ensure or monitor that everything is okay with the Mr. Chintere. That's why you are doing these things. That's why you are giving them this care before surgery. Apart from that, as a nurse that is taking care of this particular patient, you must also be able to be interested in what we call investigations. So investigation is a broad term. These investigations, they include one, blood count. So ensure that before this Mr. Chinterera goes to surgery, you've been able is been able to do the blood test, because you don't want him to go to surgery without enough blood. So they're going to accuse you, say, sister, so why didn't you follow up on the blood test? Why didn't you check the HB? Because this patient now is undergoing surgery, he doesn't have enough blood. So what do? You're going to predispose this particular patient to complications. So you make sure that on the investigation, he undergoes the blood test. You also check them. Urinalysis, you also check them. HB, you also check them. All these different investigation checks, X-ray if needed. You also have to make sure that this has been done before this patient goes to what? To surgery. Okay. Apart from that, you also have to maybe just talk about maybe if there is need for you to prepare what we call blood, you may have to prepare blood for this particular patient as they are going to surgery, because you know surgery has comes with bleeding or hemorrhage. So if there is need for blood, cross match and the staffs ordering blood, you also have to make mention of this. I should make mention that preoperative care is very simple. Just don't think too hard. Think of those small things that are done on the ward when preparing for a patient for this particular, surgery. Okay, so those are one of the. That is also one of the interventions that you may take in consideration when you are giving this preoperative care. Apart from that, also talk about maybe you are going to cannulate the patient, because when the patient is going for surgery, they must be cannulated. There should be a provision for anesthesia and everything. So this patient should be cannulated. If at all there is need to catheterize this patient should also be catheterized. You must also make sure that you remove the jewelries, you remove anything that could harm the patient during the surgical procedure. Apart from that, you also have to make sure that this patient is in what we call a hospital gown before they go to this particular procedure. Okay? And then last but not the least, ensure that you document all the documents for this particular patient that is going for surgery are at the right place at the right time and in right condition, so that when this individual is going for surgery, those surgeons are just able to follow through to say, okay, at 12 hours the vitals were like this, okay, the temperature was like this, the blood pressure was like this. Not you are taking a patient to surgery, you don't even know how the recent blood pressure was. So you have to keep these things in consideration. Okay, let's also just talk about the last question, which is what section which is question D. State 5 complications of let me check again. State 5 complications of state 5 complications that are likely to occur following laparotomy. So what are the complications that are going to occur following laparotomy? So this is now after the surgery, after Mr. Quintero has been able to undergo this exploratory, laparotomy. What are the possible complications? Remember, on the M's, these were things you were trying to avoid by giving this preoperative care that I'm mentioning. So one of the possible complications that always comes with mostly comes with surgery or operation is what we refer to as infections. So sometimes, when you're performing surgery, there's what we call sterility. So if you're not able to follow the sterility, properly, you may predispose, or you may, make this patient to contract infections. Of course, these infections will bring about inflammation, and they're going to bring about pain in the patient and the likes. The other complication is what referred to as hemorrhage. It could be primary hemorrhage or secondary, it doesn't matter, but hemorrhage is also a possible outcome of this particular laparotomy procedure. Apart from that, there's also what referred to as nerve damage. So when they are making incisions on this abdomen, it's possible the medical personnel will be able to maybe cause damage to the nerves. Of course, if they cause damage to the nerves, it will bring about now things like paralysis and the like. So you also have to make mention of this. Apart from that, this particular laparotomy can also bring about what we call phlebitis. Phlebitis is basically the inflammation of the veins, or the blood vessels in general. If they are making these incisions within the abdomen, of course they are going, or they're cutting through blood vessels. So it's possible that they may damage the blood vessels. So this is what I just wanted to guide you on how to answer questions such as this. I hope this has been of help. Make sure to subscribe to this YouTube channel because I'll be answering more of these questions in various courses. Could be pathology, medicine, and other different courses that are in line with the field of nursing and the midwifery. We're going to stop here.